Presentation.
Thanks, Jackie. And thank you so much for having me. I'm really excited to be here. As mentioned, my name is Laura Hergott, and I'm the manager for the Healthy by Nature program at the BC PaRx Foundation. And I live and work on the traditional unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. At the BC PaRx Foundation, we're all about connecting people to nature, and we do this through a few different programs. And one of the ways we do this is through PaRx, or Park Prescriptions. It's Canada's national nature prescription program, and I'm here to tell you all about it. In a nutshell, nature prescriptions formalize an evidence-based recommendation to improve your health by spending time outdoors in writing, giving it the same weight as a traditional prescription for medication. Now, in this presentation, I'll introduce the concept of nature prescriptions. I'll talk about the mechanisms behind the health benefits of nature. I'll review some of the many health benefits of nature, including specific benefits for adults, for kids, as well as benefits to our planet. Finally, I'll go over how PaRx actually works as a program and the importance of spending time in nature for personal resilience. All right. So I always like to start by thinking broadly about what keeps us healthy. And according to the World Health Organization, lifestyle factors, our day-to-day habits, are responsible for more than half of health and quality of life. Our interaction with the healthcare system, going in, seeing a doctor, taking medication, getting your blood work done, that accounts for actually quite a small percentage of what keeps us healthy. And we often hear about the three pillars of health. Typically, we hear about nutrition, exercise, and good sleep. I'm sure you've been told sometime throughout your lifetime, you need to eat the rainbow, eat all your colorful veggies. You need to get your 10,000 steps in or your 20 minutes of vigorous activity, and you need to get 8 hours of sleep per night. We've grown up with these, we've heard these over and over. But at PaRx, we consider nature the fourth pillar, just as important as the other three. And we're not the only program that's doing this. So Park prescriptions began as a grassroots movement in the United States over a decade ago and have since spread to countries around the world. Building upon modern practices like Shinrin-yoku or forest bathing in Japan and the wider phenomenon of social prescribing, nature prescribing specifically seeks to connect people across the lifespan to the outdoors to improve their health. I've just put a handful of examples of different programs around the world that are promoting this nature health connection on the screen, but this is no way an exhaustive list. There are many, many more programs. Traditional Indigenous ways of knowing, which include natural or first laws that view human and ecosystem health as deeply interconnected, have recognized the importance of connecting to the land since time immemorial. Now, the BC PaRx Foundation chose to implement a nature prescription program specifically for four main reasons. The first is that it's easy and effective. The beauty of PaRx is that almost anyone can increase the time they spend in nature, no matter what their physical abilities are or where they live. A recent study from 2023 found that nature prescriptions compared to usual care had significant improvements in blood pressure, anxiety, and depression symptoms. And healthcare providers are always looking for easy and effective ways to improve their patients' health. The second reason is because writing it down works better. Studies suggest that written prescriptions are better received than oral advice in motivating people to actually make a change. Just like a doctor's appointment or a coffee date or even a New Year's resolution, you're more likely to stick to a commitment when it's written down and when it's specific, tangible, and it can be measured. That's how we write good, effective goals. The third reason is because surveys reveal that doctors and nurses consistently rank as the most trusted professionals in the country and globally. More than teachers, more than police officers, more than politicians. They are well-respected professions in our communities. One of our patients, Jillian from Manitoba, said, "Getting a prescription for nature from a medical professional made me think more seriously about it, and I made a point to get outside whenever possible." And finally, connecting people to nature for their health has been shown to be one of the most effective ways to build public support for planet-friendly policies. More than talking about wildlife or, the polar bears or the rainforests or ecosystems that some people may never feel personally connected to. Making it personal, talking about your health, talking about your family's health, has been shown to be a very effective way to create positive change. Now, before jumping into the science, and if you couldn't tell from Jackie's introduction, I love the science piece of this. I do want to start with just a bit of a personal reflection on why nature can be such a powerful prescription. So I want everyone here today to take 30 seconds and maybe close your eyes and think about how you feel when you spend time in nature. Maybe think about a walk you went on recently or a particular moment in time, maybe your favorite section of the trail, maybe the sounds of waves on a beach. And if you could sum up that experience in one word, what word would that be? And if you're here in the presentation, I'd love for you to add that one word to the chat and I'll read some aloud. And if you're watching this back later, I would just like you to take this 30 seconds as well and think about it. So I can see we've got grounded, wonder, invigorated, joyful, relaxed, gratitude, rejuvenating, peace, restorative, calm, energized, free, freedom, more energized, gratitude, peaceful, home. Oh, I love that one. Harmony, better, alive, connected. Oh, these are fabulous. So I've done this exercise with a variety of different groups. I've done it with doctors, I've done it with teachers, I've done it with kids, camp counselors, park operators, and now I've just done it with you. And what's really interesting is that the same words come up no matter who I'm talking to. These really positive words: refreshed, calm, peaceful, alive, happy. Humans have this innate connection to nature, with nature, because we evolved with it. Biologist Edward O. Wilson even gave this concept a name. He calls it biophilia, which directly translates to love of living things. Since biophilia, two main psychological theories have emerged that help to explain this feeling, the health benefits of nature. The first is stress reduction theory. So early on in human evolution, stress responses typically occurred in situations of real danger, like facing a predator or a similar life-threatening situation. But in today's society, where 80% of people in Canada live in cities, we're in a near constant state of stress due to overstimulation by our urban environments, by all the lights and the people and the noises and the cars, construction and ambulances. We're always stressed. So in 1991, about 30 years ago, based on numerous existing studies, Roger Ulrich proposed stress reduction theory. Essentially that looking at natural elements like plants and water creates positive emotions and feelings that have a restorative effect, easing our state of mind after a stressful situation. The third theory is called attention restoration theory. So environmental psychologists Rachel and Stephen Kaplan describe two forms of attention. The first is called voluntary attention. This allows us to focus on a task requiring significant effort while ignoring external distractions like our thoughts or environment. In our daily lives, we're constantly using our voluntary attention. You're probably using it right now listening to this presentation. You're using it when you're answering emails, when you're responding to phone notifications, engaging with others. But the other type of attention is called involuntary attention, and it's effortless, automatic. And we don't have to tell our brains to use this type of attention. It's when we find something intrinsically interesting. And according to this theory, our voluntary attention, that first type, is a limited resource, and it fatigues after significant use. This leads to more distractibility, less ability to make decisions, and you have a higher susceptibility to burnout. On the other hand, exposure to nature engages our involuntary attention. This allows our voluntary attention to take a break, to basically recharge, so that we can then come back to work or task or whatever it is, ready to pay attention again. Scientists have also made an effort to understand how forests can make us healthier on a molecular level. For example, some plants and trees give off phytoncides. It's this molecular structure I put on the screen. These are airborne chemicals with antibacterial and antifungal qualities that help them fight disease. The trees and plants fight disease and ward off other pests. And when we breathe in forest air, we also breathe in these volatile organic compounds. It's literally that smell of trees that you get, after a fresh rain. And in a study, in a controlled study, they put people in a hotel. And some of the rooms had phytoncides diffused into them, and some of them didn't. And that was it. There was no other nature connection. It was just that smell of trees. And then they did a whole bunch of assessments, and they found that those people who were breathing in the phytoncides had a boosted immune system, and it lasted for more than 7 days. Just the smell of trees has health benefits. The outdoors also has biophysical properties like cleaner, cooler air, softer ground, and uneven surfaces that are really good for our muscles and motor development. Finally, people who spend more time in nature are also significantly more likely to meet physical activity guidelines and to be more socially connected to your community. So it's improving our health in more ways than one. Think about it. When there's something intrinsically interesting in nature, you're moving from one side of the trail to the other. You might be inspired to hop up on a log and balance beam your way across, or take a few extra minutes and go up to that optional viewpoint, taking those extra steep steps, to get there. Or if you're having, a good time chatting with a friend in nature, you might say like, you know what, let's do another lap around the pond. I want to keep going. And even if you're in nature by yourself, you feel connected to your community, to all the other folks whose, muddy footprints you can see in the mud, or a community like this. It brings people together. Okay, so now I'm going to move on to the many health benefits of getting outside. And we're going to start with adult health. So over the next few slides, I'm just going to touch on how spending time outside affects mental health, chronic disease, cancer care, aging, and work performance. And although I can't go into depth on any single health outcome, I could give an entire presentation about each one. We do have a ton of great resources on our website that dive deeper into these individual topics, and link to all the relevant papers that you can check out and download after the presentation. And throughout this section of the presentation, I want you to not only think about yourself, but I want you to think about your family, your friends, kids, your parents, coworkers, and maybe how some of this could apply there as well. So first comes mental health. It's estimated that 68% of PaRx nature prescriptions are written for mental health reasons. Studies show that spending time in nature reduces feelings of anger, aggression, fatigue, and sadness while increasing self-esteem, happiness, and feelings of calmness. People who walk in green spaces instead of on a busy street have fewer repetitive, racing thoughts. For example, they did a whole bunch of brain imaging on people, and after a 90-minute walk in nature, There was decreased neural activity in the section of the brain associated with rumination. That, when you get stuck in a thought and you're thinking about it and it's pretty stressful, that section had decreased neural activity. After a 90-minute walk in an urban setting, there was no change. That section of the brain was lit up just as much as before the walk. Andrew from Alberta put this into words. He said, "Spending time in nature is a huge help in staying healthy while battling severe PTSD. Helps you stay in the moment when everything in your head is just demanding attention." We hear this sentiment from our patients a lot, and I can very much personally relate to this one as well. When I've been city-bound for too long, or even just inside for too long, I can feel my shoulders rising, my frustration building, my temper shorten, and then a quick trip outside. Typically, it's when I walk my dog. I can close my eyes. I can really breathe. I can hear the stream. I can hear birds. It always makes me feel better. Another one of our patients who preferred to stay anonymous, she said, "I feel like it's the only thing that always helps my mental health. It's keeping me alive and saving my marriage." Here's one of my favorite studies. It's from 2019, and it took 36 city dwellers and asked them to have a nature experience in an outdoor place of their choosing that brought them a sense of contact with nature at least 3 times a week for 10 minutes or more. And I really like this study because they told them you can self-define what a nature experience is. They didn't say you have to go to a particular park, you have to hug a tree or lay on the ground or meditate. They just said any nature experience anywhere. Check your saliva, and we'll take the data and let you know what we find. And what they found is that their cortisol, or their stress hormone levels, were 20% lower after a nature experience compared to a non-nature experience. And this graph on the right, don't really need to understand it, but it's that red line going down. That's the nature experience and the cortisol levels. But the efficiency of this drop of cortisol was greatest between the 20 to 30-minute mark. And that's that little red line that's kind of lower than the rest. That's that 20 to 30-minute period. And so whenever we're talking about medication and we're talking about a prescription, we want to talk about dose. And so our recommended dose of nature is 20 minutes at a time at the minimum, based on this study. Okay, so chronic disease. A review of 143 scientific studies showed that spending time in nature cuts your overall risk of diabetes, heart disease, respiratory disease, and stroke. That's over 100 scientific studies found that. And this is due to a combination of individual health effects. For example, adults who spend more time in parks are 35% more likely to meet physical activity guidelines and have a significantly lower risk of obesity. Sitting, walking, or just relaxing in a forest can drop your blood pressure. And if you have diabetes, taking a stroll in the woods can reduce your blood sugar levels by the same amount, whether it's a short or long distance walk. It also supercharges the effects of exercise. Adults who exercise outside feel more energized, happier, and less stressed after exercising than those who exercise indoors. James from Manitoba said, "I can walk farther because of my daily nature walks, and my time in nature alleviates my frustration at my physical limitations. I'm almost certainly at a lower weight, breathing better, lower heart rate and blood pressure, and all around not just happier, but more fulfilled, even with the poison ivy and sunburn, side effects of getting outside in nature." Nature time also improves immune and respiratory function by lowering unhealthy exposure to air pollution. This lowers the risk of illness and death from pneumonia and bronchitis. I talked about earlier in the presentation those immune-boosting phytoncides that trees produce. It's been shown, right, that spending time in nature boosts your immune system, and it can last for more than 7 days. It can also cause an increase in anti-inflammatory cytokines while decreasing pro-inflammatory cytokines, basically just improving inflammation in your body. And this has downstream effects on things like asthma, for example. The last study I highlighted 20 minutes as that best bang for your buck when getting some time in nature, but this one talks about a weekly dose. So this one was done also in 2019 with close to 20,000 adults in England. And they asked them how much recreational time you spend in nature, and then asked them questions about their health and well-being. And then after they controlled for a number of different factors like income, existing health status, proximity of green space to them, what they found is that the adults' likelihood of reporting better health and well-being was significantly greater when their nature contact was greater than or equal to 2 hours a week recreationally. And so in our program, we recommend 20 minutes at a time, but we say at least 2 hours per week. That's our recommended dose. Another patient quote here says, "It's helped with my mental and physical impairments more than prescription drugs have done. Just being out in nature helps take my mind off the chronic pain I'm in and eases my anxiety and depression to manageable levels." Research also suggests that everyday nature exposure is a powerful way to improve physical and psychological recovery in cancer survivors. A review of 11 studies of patients with cancer showed that spending time in nature helped them connect to loved ones, created a safe space for them to contemplate their future, and stay more active. Patients describe nature as a secure base from which to explore new perspectives while navigating life with cancer. Wenjing from Ottawa, Ontario said, "Hiking on beautiful trails helped to relieve my stress and anxiety after my cancer diagnosis." Physically, a 12-week integrated medical intervention that connected cancer patients to nature increased their tumor killing cell activity, along with their quality of life and spiritual well-being. It's literally helped them fight their cancer. Finally, 90% of cancer survivors reported better strength, agility, and endurance after participating in a year-long vegetable gardening program. 40% of participants also increased their daily fruit and vegetable intake. Remember those other pillars of health. And 60% increased their weekly physical activity by at least 30 minutes. The authors suggest that gardening can be a promising strategy to improve healthy eating, physical exercise, and overall health in cancer survivors. In seniors, spending more time in nature increases feelings of youthfulness. Researchers suggest that improved air quality, stress relief, or promotion of physical activity could all be contributing factors to their observation of better reported health. When we asked Cindy from Medicine Hat how spending time in nature has affected her health, she said, "I have more energy during nature time and enjoy the outdoors and appreciate everything with our grandson. This all contributes more to our health and wellness and is contagious, so to speak." Now, this health outcome is one of my absolute favorites to share, and it's that seniors who garden reduce their risk of dementia by 36%. This is a higher reduction than those who walk every day. Gardening, getting outside, getting your hands on the dirt has great positive effects. It's also been shown that it can literally extend lifespan. A study with over 3,000 people in Tokyo found that living closer to walkable green spaces had a higher probability of survival, independent of their age, general health, or income, can help you live longer. This study here looks at how being around more nature affects our health perception. The study was done in Toronto, it's where I actually grew up, and it took high-resolution satellite imagery and individual tree data and looked at data from the Ontario Health Study and self-reports of health perception. And it showed that 10 more trees per block affected health perception similar to an increase in personal income of $10,000 per year, moving to a neighborhood with $10,000 per year higher median income, and even being 7 years younger. And this is really interesting because things like age and income and these other lifestyle factors, like I said, affect more than half of what makes us healthy. And so this can really show how powerful our everyday environment is to our health. All right, last slide for adult health. And it's about how more nature can improve how we feel and perform at work. So workers whose offices have live indoor plants and windows looking out onto green spaces are more satisfied with their jobs than those without. A short walk in nature also improves memory and boosts creativity. That comes back to that attention restoration theory, that nature activates our involuntary attention, allowing replenishment of our directed attentional mechanisms. Nicole said, "As soon as I arrive to the mountains, my stress melts. It gives me such an emotional recharge. Plus, I did some hard things that made me more confident." There are a lot of things you can do to boost your nature contact at work. For example, if you have a desk, you can orient that desk towards windows that looks out onto a green space. Having indoor plants is great, but even pictures of nature has been shown to decrease stress. Don't neglect the other senses, particularly sound. Make a playlist of nature sounds with birds or rains or waves. Listening to nature can have a calming effect. Try it instead of the radio or, podcast. One of our prescribers has completely transformed her clinic waiting room with plants and nature sounds, and it just changes the whole atmosphere of the clinic. Okay, so for kids, nature prescriptions for kids are a low-cost intervention that offer many upstream benefits. Exposure to nature in childhood has been linked not just to the immediate health benefits, but they're associated with better health later in life. There's been a lot of longitudinal studies that show how nature connection in kids can have an effect on the individual's health 30, 40 years later. A study of over almost 1 million people showed that children who grew up around more green space had a significantly lower risk of developing psychiatric illness as adults. This included eating disorders, depressive disorders, and substance abuse. Children with a greener childhood also score better on the Strengths and Difficulties questionnaire, essentially a mental health screening tool for children, especially the emotional symptoms section. Regular contact with nature also decreases depressive symptoms in adolescents, and it boosts confidence in young kids. Now, I want to talk a bit more in depth about the effects of nature time has on ADHD, because this is a really cool one. So this is a small pilot study done in Chicago with kids with ADHD, or attention deficit hyperactivity disorder. And the researchers guided a group of these kids through 3 different 20-minute walks through 3 different areas. They walked them through a city, they walked them through a neighborhood, and they walked them through a park. And they found that after only 20 minutes in a park, the kids improved their digit span backward score, which is a measure of verbal working memory and commonly used in ADHD. And it improved this score similar to kids without ADHD, whereas the walk in the neighborhood or the downtown didn't have that big an effect. And this is a really great study because it separates out the effects of exercise. We know exercise is good for us. It's good for our brain. This only looks at that nature contact. And going for that park walk rivaled the peak effects of prescription stimulant medication like Ritalin at improving this DSB score. It rivaled prescription medication. So this really talks to how powerful nature time can be as an adjunct to what's normally prescribed in the office. When I presented this to a group of camp counselors, we talked about how they can incorporate more nature into their day-to-day. They talked about, okay, before we sit down for like a focused writing or reading activity, we'll go outside with the kids for 10, 20 minutes. And when they came back inside, they were always more focused, more ready to transition to that quieter activity. Like adults, a lot of the same positive health effects have been shown in kids, like promoting physical activity, reducing the risk of childhood obesity, boosting lung capacity and elasticity, reduces the risk of asthma, lowers the risk of developing allergies. One possible mechanism that's discussed a lot is the biodiversity hypothesis. This suggests that green space exposure positively influences one's microbiome, or basically the bacteria that live inside of us, which in turn could influence, for example, lung function and immune system development. By being exposed to all these bacteria in the environment, we're teaching our bodies to fight the bad ones and keep the good ones. Canada's chief public health officers have recommended that access to active play in nature and outdoors, with its risks, is essential for healthy child development. Now, you could do an entire presentation just on risky play, and if you want to learn more, I recommend checking out the Canadian Pediatric Society's position statement that they published last year about this topic of risky play. It's a really great position statement. Along the lines of better mental and physical health, kids also do better in school when they're exposed to more nature. A study of over 100 high schools in Michigan, after controlling for a bunch of different factors, found that schools with more trees and plants visible from classroom windows had higher standardized test scores and better graduation rates. Spending time in nature has also been shown to literally make kids' brains bigger, specifically in areas that improve memory and attention. Kids have also been shown to be more kind, cooperative, and display better teamwork when learning outside. Teachers say their kids are more engaged, more able to retain knowledge, and think more creatively when teaching outdoors as compared to teaching indoors. Teachers also reported students are more likely to show care and respect for the school grounds, promoting environmental stewardship from a young age. Finally, the benefits for expecting moms. A study of over 2,000 expectant mothers showed that those who live near more green space delivered babies with higher birth weights. The authors suggested that this might be due to less exposure to air pollution, noise pollution, and heat, which reduces stress on mom and baby. Research also suggests that women who frequent neighborhood green spaces exercise more and feel more connected to their communities. Okay, so like I said before, every slide and positive outcome I've just talked about in the last few slides is backed up by research, and we have all these resources on our website. But now I want to shift gears. We've talked extensively about the health benefits of nature for humans to spend time in nature. But one of the best things about nature prescriptions is the positive effect that they can have on the planet. And I don't think I need to get into why it's so important right now to be discussing planetary health. So first of all, if the global healthcare sector was a country, it would be the 5th largest greenhouse gas emitter in the world. So improving people's health status with more nature time can have a big impact on reducing healthcare's climate footprint. It's all about preventative medicine. Heading outdoors 3 to 4 times a week lowers your likelihood of taking blood pressure pills by almost 40% and mental health medications by 30%. More people valuing time outside for health also means more active transportation like walking and cycling, helping reduce air pollution and carbon emissions. Research also shows that kids who have more nature experiences growing up are more likely to become adult environmentalists, and adults who are more connected to nature are more likely to protect it. And finally, a survey found that a message using the personal health lens and framed as an opportunity was one of the most effective ways of changing people's attitudes towards planet-friendly policies, more than the doom and gloom tactic that a lot of environmental organizations use, or focusing on animals and ecosystems like this lovely grizzly bear. Using health, framing it as an opportunity, we're able to grow support for nature. And then there's just one more argument that can help make the case for some people who might not be convinced yet. And that's actually benefits to the economy. So health expenditures to treat chronic disease and mental illness now outpace economic growth. We need to shift our focus to wellness, not just illness. Creating more parks and getting people into them is one of the most effective and efficient strategies for improving health, reducing healthcare costs, and stimulating the economy. In the UK, it's estimated the National Health Service could save over £2 billion in healthcare costs if everyone in England had equal access to good quality green space. Worldwide, an Australian study found that access to protected green spaces provides an estimated $8 trillion in mental health cost savings every year. Just mental health alone, $8 trillion. Healthcare professionals are in a great trusted position to influence public and decision makers in public policy discussions that have an impact on human health. So we encourage them to advocate for green spaces and for protecting nature. Okay, so taking all of this evidence, the benefits to human health, planetary health, and even the economy, I'm now going to finally get into nature prescriptions and what they look like and how they actually work. So like any medication, we recommend a specific dose. And I mentioned it, that we recommend 2 hours a week, 20 plus minutes at a time, based on these studies that show that this is the best bang for your buck. Now, if this is far outside your reach, start with 1 hour, work your way up, or if you're already spending 4+ hours outside, challenge yourself, increase the goal. And importantly, the more meaningful connection the nature is, the more health benefits you're going to get. Realistically, you could watch Netflix outside and you'd still be getting some health benefits, right? You'd still be breathing in those phytoncides. You'd still be breathing in the cooler, cleaner air. But unplugging from unplugging from technology and connecting to nature is going to really boost those health benefits. We also recommend that our prescribers personalize these prescriptions. The health benefits add up when you feel you've had a meaningful connection to nature, whether it's sitting on a bench, hiking up a mountain, or listening to bird sounds on a playlist. This makes these nature prescriptions all very different. Everyone's is going to look a little different. So my nature prescription might look like walking my dog through the forest trail near my house in the morning, taking my coffee break outside at the office, and then a hike with my friends on Saturdays. But someone else's might look like journaling under a tree twice a week, watching sunset on Wednesdays with family, and gardening on the weekends. And what you'll notice about these prescriptions I've just said is that there's always a who, a what, a when, and a where. They're specific. You're more likely to do something when it's written down and it's written into your schedule, and further, if you involve someone else. We play this trick on ourselves all the time. Just like going to the gym. If you say you're going to meet a friend at the gym on Tuesdays at 5 p.m., you're more likely to do it because you actually wrote it into your calendars and because you promised to meet a friend there. You'll also notice there's nothing too impressive about these prescriptions. I didn't say run a marathon or take up scuba diving. I said drinking my coffee outside, walking my dog. These are simple activities that either I already like doing or slight modifications on what I was doing. We call these green tweaks, and it's the easiest way to add more nature time to our day. And that's that switch from drinking my coffee inside the office to drinking my coffee outside the office. Something I already do doesn't have to be inside. I can do it outside. We recommend that our prescribers follow up with the prescription at the following appointment, see how that's doing with the patient, if there's any tweaks they can make, are they facing any challenges or barriers. And then we also recommend that our prescribers be the change themselves. Science shows that patients who see and hear evidence about their healthcare providers putting their nature recommendations into action are more motivated to change their own behaviors. So every year on PaRx Day, which is the third Sunday in July, we encourage all of our healthcare providers registered in our program to organize a walk in their community. It might be with their family, office staff, or even their patients. And we tell them if they walk their bike to work every day or one day, to tell their patients about that. Now, we try to make this really as simple as possible for our healthcare providers to prescribe nature and for patients to be successful in building their new nature habit. So for example, I have this worksheet, or not worksheet, handout here on the right, and it's focused on adult health. We have about 14 of these, each about a different health outcome. And it's got these basically quick facts about how spending nature can improve adult health. And then it's got these quick tips for how to make the most of a nature prescription. Now, if you're still kind of confused about like when would a nature prescription come up during an appointment, we like to relate it to the other three pillars of health. That whenever a healthcare provider is thinking about doing counseling on eating healthy, getting exercise, or getting good sleep, spending time in nature is that fourth recommendation that they need to be talking about. And if you just made a New Year's resolution about your health, I hope you add getting outside to it. Now, this is an example of a real PaRx prescription given to a patient, Alicia. She's a 43-year-old woman who presented with anxiety to a pharmacist. She had trouble focusing at work, especially in the afternoon, and had a hard time falling asleep. During her lunch breaks, she doom scrolls in the staff room. So her pharmacist wrote her this prescription for 2 hours a week, 20 plus minutes at a time, and it suggests that she spend her lunch break outside when she can, going for a walk, or even sitting on a park bench. She's also told to take work calls outside instead of in her office when she can. And before bed, she's told to take a short walk in the evening. These steps will help reduce her anxiety, improve her focus, and get better sleep. Seems really simple, right? And that's because it's really meant to be. And you'll notice we added a couple green tweaks into her prescription. Now, this is another prescription. This is for an individual named Janice. She's an 81-year-old retired teacher. She has a past medical history of Alzheimer's dementia, hypertension. She's wheelchair bound. And basically following an extended post-op stay in the hospital, she was discharged back to her nursing home. But the nurse in charge reports that she's been waking more at night, she's confused, and more agitated during the day. She gets daily visits from her son in the evening, and they watch TV in her room and chat. So her prescription included encouraging her son to use the visit time to go for short walks outside, to sit on a bench outside in the nursing home property, and if the weather's too cold, to sit near a window or put nature shows on the television. This is all actually backed up by scientific evidence that just watching pictures of nature, having pictures on your wall of nature, listening to nature, those indoor plants, sitting near a window, they all have additive benefits. Alicia was issued her prescription from her pharmacist, and Janice was issued hers by a nurse. This is because not everyone in Canada has a family doctor, and because health benefits of nature are so varied, any regulated healthcare professional in Canada can prescribe nature with us. This includes social workers, occupational therapists, physiotherapists, and many other allied health professions. My sister-in-law is an optometrist, and she prescribes nature all the time. Studies show that just 1 hour a day of nature results in a 45% reduction in the occurrence of myopia or nearsightedness in children. It can cut your risk of needing glasses in half. Since launching the program 4 years ago, more than 16,000 Canadian healthcare providers have incorporated nature prescriptions into their practice. You can see it on this map here that they come from all across Canada, many in Ontario. Our program's been endorsed by more than 100 Canadian health and parks organizations. And since 2020, it's estimated that more than 1 million nature prescriptions have been issued to Canadians. One of our patients, Carolyn, said her prescription was the best prescription I have been prescribed. For its national impact, we've been recognized by the World Health Organization as an effective way to inspire protection and restoration of nature as the foundation of our health. And our team also advises on 2 international projects that aim to scale nature prescriptions globally. Now, although Canada is known for its beautiful nature, entry fees and lack of transportation can be barriers for people trying to fill their prescription. So to ensure that everyone in Canada has access to the healing powers of nature, we work with our generous partners to reduce these barriers. For example, we partnered with PaRx Canada to provide free annual discovery passes, so patients can access national parks free for a year. In Ontario, we're also partnered with the Toronto Zoo, Canadian Museum of Nature in Ottawa, Toronto and Region Conservation Authority, Lime, and Conservation Halton. Lime is an e-bike program in Mississauga. So improving access to nature through these partnerships has had a huge impact on people's health. And as discussed, by connecting people to nature for their health, we're building support for nature at the exact same time. Stephen from Calgary said, after PTSD diagnosis several years ago, it was very hard to leave my house. This access pass has encouraged me to get out, even if not to one of the parks, to be in the outdoors. It's really helped in my recovery. Sometimes visiting your local park isn't very exciting, but visiting one of these really special nature spaces can be inspiring. And it can inspire you to connect to nature more in any way you can. Get out to your local park or just in your backyard. Now, before I wrap up the presentation, I need to give you some homework. So this is an activity to design your own nature habit. Essentially, write your own nature prescription. And I encourage you to think very seriously about this, just like any other goal you'd like to achieve. Screenshot this, jot it down right now, or take a picture on your phone. I want you to think about these 6 questions. First, write your goal. How much time should I spend in nature? Make it specific. How many hours per week? How many minutes at a time? Think about what you already spend and if you want to challenge yourself. Ask what you should be doing in nature. List a few activities that you already like doing or activities you want to try. Think about where you should go for nature. Think about 2 to 3 locations that are easy to access for you. Maybe it's Spruce Trail. Think about when should you spend time in nature. Not just adding it into your schedule, but really think about those 3 easy green tweaks. Going to nature for a hike, for example, is great, but where can you incorporate more nature time just in your day-to-day routine easily? And while I finish going over this, I would love for some brainstorming to happen in the chat. If you've already thought of a green tweak that you want to add to your life, I'd love for you to add it to the chat and I'll share them. I want you to think about how to stay accountable. If you can involve others, your family, your friends, coworkers, and how you can add it into your calendar. And then I want you to follow it up with your healthcare provider. Tell them about your nature habit. Tell them about PaRx. Have they heard of it before? Because they can help keep you accountable too. And others should know about this as well. We should all be prioritizing nature time for our health. Are there any green tweaks that you've thought of that you want to add to your life? So we've got photography. That's a great one. That's probably a hobby you already have and you already like doing in some spaces, but doing it in nature. Someone says, I envision a PaRx BTC badge. Ooh, I'll have to tell me more about that after. Hiking on Bruce Trail. Oh, the iNaturalist app. Yes, if you have not heard of iNaturalist before, it is such an incredible app. Um, it's basically about identifying plants and animals in your area, and then it gets uploaded, and then it's a community science tool where scientists can then go and take all these observations and answer their scientific questions, and it's so fun. Definitely encourage you to use the iNaturalist app. Another one, walking or biking to do errands. Perfect. Maybe instead of driving, if you could walk or bike, that's great. Doing art in nature, watercolors, black ink pen, plein air gatherings. Love it. Walk, don't ride when you golf. Oh, that's a really great one. I really like that idea. You're already out in nature, but just adding a little bit more connection. These are great. Thanks for everyone who added some ideas. And we can talk about it more in the Q&A if more ideas pop up for you. Oop. All right. So consider this presentation and maybe that last slide as an informal nature prescription for you, yourself. Design your nature habit and stick to it. If you are a licensed healthcare provider, register to prescribe nature with PaRx or tell anyone you know who is a registered healthcare provider. It'll be on our website on the last slide at parkprescriptions.ca. Signing up for the program provides valuable support for the nature health movement in Canada and globally. And then finally, I want you to make nature the fourth pillar of health in your community, whether that's in your household and, implementing a Saturday morning walk or bike ride. If it's at work, encouraging walking meetings or, doing outside coffee breaks or making a nature sound playlist and putting it in your Slack channel. And if you do these things, when you make nature the fourth pillar of health in your community, talk about it with anyone who will listen. This is going to help inspire others to take similar actions, and the more people valuing time outside and learning about and enjoying the outdoors, the more support for it we'll have. We're trying to spark a movement, the nature health movement in Canada. At the BC Parks Foundation, we like to say that by enjoying our time outside now, we can protect it forever. Thank you so much for listening. I have our website down there, parkprescriptions.ca, and I also have our email, PaRx@bcparksfoundation.ca. Please feel free to reach out, and I'd love to chat with you all and answer any questions you have or to talk more about green tweaks or your other experiences with nature.
Thank you so much, Laura. That was a lot of great information. I really love the scientific evidence that you give to why green spaces and being out in nature is so important. I know for myself, I like to have a nature picture on my desktop so that even when I'm working away here in the office, I can, gaze at what it might look like outside on a less chilly day. We have about 10 minutes now for any questions that anybody might have. You can type a question in the Q&A, or you can raise your hand and Ryan will unmute you and you can ask your question live. But if you do have a question for Laura, please do type it in now.
I love that about your computer background, Jackie. I do the same thing on my phone background. I always have a picture of nature.
All right, we've got David has raised his hand. And David, you should be able to talk if you just unmute yourself.
I just unmuted myself.
Go ahead.
Can you hear me?
Yes, we can.
My question is, I believe PaRx has come to Halton region. When will it be available in Niagara if it is not already?
Yeah, that's a great question.
I have a second part, Laura. I find that access to many great spots in Niagara are prohibited by paid parking. Is there any way around that? I'm thinking Niagara Glen, Queenston Heights. That's a significant obstacle to people accessing. Is there any way around that? Has anybody ever dealt with municipalities that charge for access to these areas?
Yeah, thanks, David. That's a really great question. And thank you for mentioning Conservation Halton. So we just announced a new collaboration with Conservation Halton, and what they've done is they have provided 10 free visits for any patient with a PaRx prescription. And being available in Halton, it's available in Niagara, it's available in Halton. So we ask our healthcare providers to essentially register individually. And as you can see on that map, they're all across Canada, and I guarantee they are in the Niagara region already. And in terms of working with, for example, Niagara Escarpment Conservation Authority, we are in discussion with a variety of conservation authorities across Ontario, including in Niagara, talking about how to bring PaRx more to these areas. So absolutely. And some of the ways that we are doing this and how it works in some of these areas is with those parking fees. So some of the conservation authorities, for example, that's what they charge. You can bike and walk for free or take public transit to the area, but it's that parking fee that can be a barrier. And that's exactly what we're doing through these partnerships. If you go to our website, parkprescriptions.ca, and there's some tabs at the top. If you go to the patients tab, there's a section, PaRx partner offers, and it lists all of our partner offers. It describes the one with Conservation Halton. And as we make new partnerships, those will also be posted on that page.
Thanks, Laura. A couple questions here about whether this webinar will be posted to the website, and it will. So you'll be able to see it there, and you can send it on to anybody who would like to see it after the fact. A question here about what are the health professional commitments to joining the program?
Oh, I don't see that one.
The chat.
Oh, it's in the chat. Oh, sorry. Commitments. You mean like what does a healthcare provider need to? Oh, I see. No brainer. So it is a no-brainer, and it is very easy. Essentially, healthcare providers just need to fill out a quick form on our website. That's mostly just their email and where they're located. And then we make sure that they are in good standing with their licensing college. Our program is only for licensed healthcare professionals in Canada at the moment. And then we welcome them to the program, and we provide them with all the tools, essentially a version of this presentation to learn about the health benefits of nature and how to write effective nature prescriptions. And then we keep them engaged through our quarterly newsletter, and we have other special events to keep nature prescribing top of mind. But it is very easy. Like it's really, there's no cost, there's no big course. It's very easy to join.
Great. And are there any limitations? Do you have to stay in your region, or can you go anywhere? Any of the partners you've met with?
So for healthcare providers to write prescriptions, it's exactly the same limitations that they have as a part of their normal practice. There are limitations of who, physicians can work with. For example, there's provincial restrictions, but it's integrated into the healthcare system. If I understood your question correctly.
I think it's can people go to different regions if you get your prescription? Are you limited just to?
Yeah, go anywhere. Like so 99% of prescriptions are just, they don't even have one of these special partnerships attached to them. The simple stuff, the going for a walk with your dog, going to your local park with your family, put your prescription on your fridge, on the back of your door, and it's just that reminder to add that nature time to your day-to-day. And then a portion of them have these, special offers attached to them to reduce the barriers.
Great, thank you. And Angela noted that the Lincoln Pelham Library has NPCA and Ontario Park access passes available to borrow, so you can get those passes right from your library. Mm-hmm. And also asked, could a private corporation that provides healthcare benefits register as an organization or register their clinicians as a group, or would it have to be up to each individual to register?
So they can absolutely register their clinicians as a group. We do have an FAQ on our website about this, but essentially it's just email us at PaRx@bcparksfoundation.ca, and we'll work with them on an individual basis to register their entire group with us.
Great. And is there a limit to the number of prescriptions a healthcare professional can issue?
Absolutely not. Unlimited. Some people write them in almost every appointment. They say they write them every single day.
That's awesome. And if one of our volunteers can get out there and get a new park or conservation area signed up, should they connect with you, Laura?
Absolutely. That's the email right there, PaRx@bcparksfoundation.ca. It's also, if you on our website, you go to the contact page and submit a form through the contact page, it goes right to that email as well. That email goes directly to me. Yep, if you have an idea of a group who's might be interested, or you already have someone interested, please let us know. We'd love to work with them, and thank you for making the connection. That's great.
Great. And how can hike leaders incorporate the prescription program into their hikes?
Yeah, that's a great question. So I would suggest including some of these, health benefits snippets into your hikes. Like the phytoncide piece, for example, the volatile organic compounds is one of my absolute favorite ones. Share that little piece of knowledge. And then, if you want to learn more, or did you know that healthcare providers can even write a prescription for this? Check out parkprescriptions.ca. They got a ton more information, but just start adding those little pieces, those little nuggets of information. Our overall goal is to just make spending time in nature for health a social norm. We just want everyone to be doing it naturally and to understand the benefits of it.
Perfect. And a question, can paramedics prescribe the prescriptions?
Yes. So if we can go to your licensing regulatory body and check that you are licensed and in good standing, then absolutely.
Perfect. I just take a quick scan, see if there's any others. Or just a comment here. What a wonderful presentation. I love your passion, and thank you, the Bruce Trail, for putting this on. Again, thanks for Laura for putting it on and adding to everybody's knowledge. So thank you so much for being here today. It's a wonderful presentation. And yeah, I hope that everybody goes and checks out the website and learns more about the importance of being out in nature. So have a great rest of your day, everyone. If you do have any other follow-up questions, please either email Ryan or Laura directly, and we'll make sure that your information is captured there. Okay. Have a great day, everyone. Thank you so much.
Thank you so much for coming.